All right, Melly, are you ready to get started?
We are.
Wonderful. Well, first of all, let me apologize. I'm very sorry that I can't be there in person. For those of you who are on the commission, you know I had a mentor pass away a couple of weeks ago, and I'm out in California for his memorial, but only that would have kept me from making it to Lake Village. So for those of you who are there in person, thank you so much. For the commissioners that are online, thank you for joining virtually. I'm actually really excited about this meeting for one main reason, and that is because we have been eagerly trying to make sure that we're getting out to rural and less populated parts of the state, that don't always get as much attention. And I know that Nellie feels this very strongly too. So we're so excited to be in Lake Village today and to be able to make this work from both a technology perspective and a real one. So thank you to those of you who are in attendance. So let me call this fourth meeting of the Arkansas Women's Commission to order. I want to remind our guests and participants that this meeting is open to the public. To make it as accessible as possible, it is being live streamed via YouTube and will be archived on our website at women.arkansas.gov. One matter of business, draft minutes for our last meeting were sent to the commissioners for review last week. At this time, I'll entertain a motion to adopt the minutes from our last meeting on April 19th.
So moved.
Second.
Thank you. Thank you. Without objection, the minutes from the April 19th meeting are adopted. Commissioners, is there any other old business that we need to cover this morning before we move on to committee reports?
I'm sorry,
Wonderful.
Allison.
Hearing none? Yes?
I just needed to know who made the motion to accept the minutes. I got Dr. Jones Branch second.
Tamika Edwards.
Okay, thank you.
Thank you. So at this time, I'm going to invite representatives from each of our subcommittees to briefly update the commission on their work since our last meeting. And Dr. Jones Branch, I'll start with you on research and writing.
Okay, good afternoon, everyone. Dr. Shields apologizes. Can everyone hear me? Dr. Shields apologizes for not being with us today. He is at their college commencement ceremony. And so he said that since the previous meeting, the data committee, we put together a data committee. That committee has met twice. We have all the census data downloaded to replicate and update the report that the Women's Foundation of Arkansas did in 2018. We've reached out to folks at Euler to help complete the previous report, and they're helping us make sure that we define the variables accurately and as he calls it, makes apples to apples comparison. So after he's done with commencement, we will replicate and update some of the tables, one table each week, and share them with the committee. We are planning to send out 1 to 2 each week. If that becomes a problem, then we'll just figure out a workaround. See what else I have here. So the plan is right now with this strategy in mind, we should have the tables and maps from the previous report replicated and updated by the end of June, quite possibly early July. And that's what I've got.
Great, thank you very much. Let's move on to the subcommittee on barriers to entry and retention. Dr. Lloyd?
Okay, are you able to hear me?
Yes, we can.
Okay, good. Just some of the activities that our committee participated in, and basically we are just trying to gather as much information in the areas that we have been given in our committee. So we did have representation from our committee for a recent event, Arkansas Minority and Women-Owned Business Event, Entrepreneurs. It was really good. I have a written report that I plan to just write up, but we could certainly have some of those speakers if we wanted to have a whole commission, or we can have it further with the full committee. So it was very interesting on that. We have one of our committee members sat with some women in STEM at some of the various organizations and suggest that if we have time, we'd like to be able to have them address some of the barriers and some of the opportunities within the STEM profession. Kathy Webb that just joined us. I see her face. And she, first of all, shared something that was really interesting about the new college hunger summit that happened to be many of the students from Arkansas State University Mountain Home, which is our next site. So I thought that was very good. And also as a possible speaker to our commission, a single mother working in the pandemic, and her story was pretty compelling. So that's something that we have. And then we continue to work as a committee on the themes that we will address in Mountain Home, which are single mothers. It's rural barriers and opportunities for remote work are going to be the themes there. And with that, that's all I have right now. And again, I'm going to write up some of the detailed information that my committee supplied to me about the workshops and about some of the articles that have just recently been in the New York Times about women and in the pandemic. Thank you.
Wonderful. Thank you, Dr. Lloyd. Any questions for either research and writing or the barriers to entry and retention subcommittees? Okay, Melly, how about an update on the impacts on of COVID-19 from your subcommittee?
Well, we have scheduled meetings every Monday at 2 o'clock. One of the things we really are looking forward to over the next week or so is trying to get the subcommittee of the research and writing group together to just really kind of help us see where their mindset is and, you know, what we really need to be focusing on. One thing that we've noticed is, and I'm sure all of you and all these committees are noticing, is the overlap and gap and, you know, where do we start and stop, and really, you know, since COVID was kind of hitting on all of these different subcommittees. So we really want to make sure that we're honing in. The other thing we thought of was really to look at, you know, bringing in, as we meet in these weekly meetings, and we may this summer go to bi-weekly meetings, but look at, you know, bring in speakers at the federal level as well as, you know, the state level of speakers that could come and really give us those stories, but more really data and information. There are some researchers out there that are doing some really good work around this. And so bringing in UMS, Minority Health Commission, Beverly's here. Beverly, is there anything else that you think we need to mention right now? Yeah, I think we're really anxious to try to put, and Allison, I know I've talked to you about this, but really trying to, since COVID was such an impact really across everything, is, you know, kind of honing in on, you know, how do we really structure and try to figure out where we start and stop. So that's really all I have for now. I mean, we have a great committee, very involved, and right now we're meeting weekly. That's all I have right now.
Wonderful. Melly, thanks so much. And yes, I totally understand that we're still, I know we're barreling towards December 1st when our report is due to the governor and the legislature. And I sense for all of the subcommittees that there is a little bit of unwieldiness about how to bring this all together. So I really appreciate you continuing to talk to the other committees and to the Research and Writing Committee. And I wanted to just mention, for those of you who were at the commission meeting last month, you may recall that Melly had offered to share a template for how to bring some of this research into a more structured fashion to go to the Research and Writing Committee for them to include it in the final report. We are working on getting that template finalized, and so it's not a requirement that the committees use it to present it to Research and Writing, but it is hopefully going to be the kind of thing that will help us deconflict or cross-reference where there's work that's going on in the various committees. So just know that I hear the stress about that. I'm working hard to make it easier, and just this is the period of time where we're really going to be getting to the messiness of all of the information, and I am still very confident that we're going to pull it together beautifully. So appreciate everybody's work on that. Any questions for the subcommittee on impacts of COVID-19? All right, and how about for family caregiving? Heather, I don't see Gayatri on. Are you able to give the report on that committee again?
Let's see, I will certainly try. The Committee on Family Giving is meeting on Fridays. We had a report at our last meeting from Tanya Williams at the Division of Child Care over at DHS, and are gathering information for our survey questions and moving forward. So that's probably the best I can do on short notice, but we are working.
Yeah, I apologize. We did expect to see her today, so I will check out and figure out what happened with Gayatri and provide a more formal report in the minutes from after we speak with her about it. But thank you, Heather, for stepping in there. Any questions on the Family Caregiving Subcommittee? Okay, so thank you to everyone for those reports, and I just want to update y'all on a couple of things on my side. So I mentioned in our last meeting that I had extended an invitation to Governor Mickey Bowman of the Federal Reserve to talk with us about the Federal Reserve's work around labor force participation rates. Senator Breann Davis has invited her to attend the August meeting, so we're very excited. She will be in person in Russellville, so we're very excited about that. I also wanted to let you know that I have made progress on locking down a location and a host for a regional meeting in Southwest Arkansas. This will likely be in October, our October 17th meeting. So I've spoken with Cheryl Edwards, thanks to Senator Elliott for making that connection. Cheryl is the assistant to the president and director of government affairs at South Arkansas University, and they're really excited about talking about having us there. So I'll have an update for you later. And then also later this month, I'll be speaking with representatives of the Forte Foundation out of Austin. In my internet research, really struggled to find these male as allies affinity groups. This seems to be the most well organized and intentional, so hope to talk to them and get a little more information about how they organize their male as allies group. Having a little bit of difficulty still on engaging the military community. I did talk with our Chief of Staff over at Veterans Affairs, who herself is a former officer, and have had a little bit of challenge getting to some folks that have been recommended to me, but still continuing to work that. That transient community also is something that I want to make sure we're taking into account. Of course, if you have any other recommendations or additional ideas about who I can be reaching out to invite as potential hosts or special guests, please let me know. And Dr. Lloyd, as you had mentioned, happy to take a look also at other potential speakers for the full commission, and always welcome y'all to do special guests for your committee meetings as well. So I look forward to that. Okay, I'm going to pause there because we're going to move on to the really important business of this meeting here in just a moment. There's a pause here for any questions or comments from commissioners before we move on. Okay, so I'm going to turn the remainder of the meeting over to our host, Commissioner Mellie Bridewell. For those of you who don't know, she is the Regional Director of Strategy, Management, and Administration at the University of Arkansas for Medical Sciences, and she is the Chief Executive Officer and President of the Arkansas Rural Health Partnership. She is going to moderate the discussion of our special guests and has a couple of guest speakers that she will also introduce. So Mellie, I'll turn the bulk of the meeting back over to you. Just as a reminder, we have a hard stop at 2:30, and so I'll be breaking in about 60 seconds before we hit that, if we haven't already adjourned that conversation, to make sure that we remain on time. So Mellie, over to you.
Thank you very much. And we have kind of introduced our guests here today amongst us earlier, but I thought we could just quickly go around the room real quick and just let everybody know who is here talking, and then we'll kind of get into some questions, moving forward. So we'll start here.
Dorisa Kaufman, Director of Adult Education for UAM.
Eileen Talavera, Community Benefits Counselor for Arkansas Rural Health Partnership.
Millie Edmonds, a business. Well.
I'm Carrie Williams from Watson Chapel School District.
I'm Mary Ashley Harper with UAMS and Arkansas Rural Health Partnership.
Demetria Edwards, local attorney, child welfare, and chair of the South Chico Rotary Club.
Tamika Butler, Mayor of Eudora.
Dominique Tony,
administrative assistant to the chief of police, also the city clerk, and mother of 5.
Beverly Morrow, Commissioner. Sharice Childers, a member of the commission and director of the Division of Workforce Services.
And so and I don't know if the camera's following us, so just for your information, commissioners, this is a UMS Satellite Telehealth Resource Center that they've started putting. We have 3 in the Arkansas Delta. So when we talk, the camera moves with us, so it's kind of cool. And it's purpose to train providers as well as patients on telemonitoring devices for healthcare. So I'll start kind of with a broad question, and feel free to step in. And I'm sorry you weren't here to prep, so that's okay, but I know you'll handle it well. So we're looking at really, what are the biggest barriers you have faced in the following areas? And I guess we'll kind of start with business, career, and finances. I mean, can anyone comment on that?
Well, in my business, in the business side, you just can't find people that you need to work in the rural area. Because if they got a degree of education, they're not gonna stay around. And then the ones that stay, you basically you got to train them and retrain them and retrain them and retrain them. And then they have issues with transportation, child care, and to get an additional education. One of them.
Like Ms. Edwards said, transportation is always an issue. We do not have public transit around, so we have to depend on family or friends helping people get to work or to college or to school. Daycare is another issue because our daycares usually run 8 to 5. We do not have the options of late access or weekend access as well. As far as employment goes, a lot of times if we're trying to hire someone, lack of candidacy, lack of experience, lack of job training and education.
In the education system, with working with our high school students, we're working very hard to make sure they are job ready while they're either 11th, 12th grade or getting out of high school. One of the problem is not knowing exactly what it is that jobs need, businesses need. So I think more of a partnership with a lot of the local businesses in the surrounding areas would help, so we can make sure that when students are getting ready for graduation or to look for a job, they are skilled in the areas that are needed.
What about finances?
I think there certainly needs to be more opportunities for education and financial literacy. And also that also coincides with how it connects with students who still need help with FAFSA and things like that. And really knowing what they need to do to become educated, knowing about the programs that some of the people here have and all of that being connected with financial literacy, what sort of tax returns need to, there's some very basics that people need to know about that they're not aware of. And so financial literacy, starting earlier on in the educational area would be something I think that would benefit people in rural Arkansas.
Well, you know, the state requires all students to have financial literacy to graduate. And when you're speaking on the financial aid, so for instance, our school district, we have roughly 1,920 something students. We did a financial aid night for parents to come in. We had career counselors there to help them fill out the FAFSA, do college applications, and we had 2 parents to show up. So that is a huge problem, is the parental involvement in schools. So, you know, the kids don't have tax returns. So when you don't have that, the parents to actually buy into it, so the kids can get the information, it's a barrier.
And you know, we were at another meeting, there's some office in Dermont, Arkansas, I can't remember what that office is. And the lady there was saying that her connection with that local community, rural community, which is about 15 miles or so from Lake Village, is that those parents didn't trust that organization to give them their social security number. So there's some work that needs to go about around the trust factor, if that's the part of it. What are you gonna do with this? Where is this stored? What does this mean? And so there is some barrier there that may need to be explored further.
And what about, in these barriers, I mean, are there things that, really women and girls are facing more than, their male counterparts, or is there different?
Oh, absolutely. Absolutely. In Southeast Arkansas, males are prone to get hired before females. Jobs, we have hard jobs in Southeast Arkansas. We have plenty of jobs for people to work on the farm. They're not going to hire females to work on the farm, even though a female can drive a tractor and do anything electronically. They're not going to hire a female to work on a farm. So that puts a limit as far as what the females can do agriculturally. But in this area is also the mindset that the mothers are the only ones that can take care of the children. Fathers don't have that tendency to really, if a child is sick, it's the mother that stays at home. So I think that is another thing that could be a barrier as well. Come on, Dominique.
I mean, I was just agreeing with it, it's true. Well, sure, because then I'm just that one secretary and she got 2 or 3 or 5 kids. And she gonna have to take off because she got to take the baby to the doctor. Or either gotta go something going on with the school, then what I'm gonna do?
And one of our issues is a lot of our parents are single parents and they're working 2, 3 jobs. So the availability for them to get to the school is a barrier.
What about, and we've kind of covered career and business, what about family, childcare, barriers there? We talked at one time about the lack of, can you maybe?
I just know that in larger areas, daycares have different shifts and different availabilities. You can drop off children before 7:30 in the morning. And I know here, a lot of the daycares are very limited. Not only are they limited, but they're limited on spaces as well. So I know that I've hired someone to work, but they couldn't get their child into a daycare that they were on a waiting list. So that can be a barrier. Also, the hours of operation on some of the daycares is a barrier as well.
What about the cost?
Private pay in this area for one child is $125 a week.
I would say I can relate to that because I have a freshly 1-year-old and he goes to school probably like 7:15 in the morning, and then they're dropping off by 3:15, and I'm still at work. So I have to get him at work and then, make the arrangements for after he comes home, because I still have to work. So I'm either dropping him off or he's gonna stay at work because the hours are to like 4:30. They have to be out by 4:30.
And if the child is sick, you have to immediately pick them up.
Correct.
They don't have a room for, I guess, sick leave children that, and I mean, truth be known, your child is getting sick from daycare. So if one has it, they all have it. So I think that would be something that the daycares may think about incorporating, is maybe a room for children that maybe if they're slightly sick or, allergies, seasonal things that's going on, maybe they can move them over into a different room.
Yeah, we actually have a couple of hospitals looking at daycares, which is interesting, and doing that same idea.
And another thing, the kids have, what you saying, have to get up early because they gotta go 20 or 30 miles from home.
To another different
To
town.
another
Yes.
day.
My son goes to Eudora to daycare. That was hard.
Yes.
So does that mean there's nothing?
They have a freshly new daycare here, but there's limited spacing in the daycare. So he goes to Eudora to daycare every day.
Allison, are y'all hearing us okay?
Yeah, actually just had a quick question in the chat before we get too much further along. Dr. Jones Branch is asking, she didn't quite catch how much a week it was for childcare. There was someone who mentioned how much it cost a week for childcare earlier.
I would say it starts off at 125, and that's just at one daycare. That's not at all of them, but usually roughly it's about $125 a week for one child from 7 to, I guess, 3:15, 5 o'clock, somewhere in there, depending on the daycare, for 5 days a week.
And one issue that we see is a lot of our teenage moms who are parents, they have a hard time with the vouchers or lack of. So we do have alternate learning for those students, what we call a Flex Academy, that they can go to. So their learning is online when they are available. So it may be on the weekends, but with the responsibility of now a new baby, we've lost a lot of students that have become moms because of not being able to have the daycare and the responsibility of the child.
Thank you. Melanie, please continue.
Sure. Okay. I'm going to move on to something that has been brought up several times in my group, is the mental health aspects going on. And of course, you know, definitely compounded with the COVID stuff, but can y'all kind of speak on that?
I can speak for days on that. I will try to keep it short. When the students started coming back from the pandemic, we started noticing a lot of different issues that we have never seen before. There were challenges that were set up. For instance, on yesterday, I was over to the high school doing a restorative circle with a few girls, and I got pulled out of the room because a young lady, she had been virtual, and she came back to school in January of this year. And she was having a mental breakdown in the hallway because of the socialization. It has become overwhelming to some students who still have come back from virtual, you know, when they spent, because we still offer the virtual option. So we have some that came back at second semester, and they are having a very hard time acclimating back to regular school. And you know, a lot of the students were virtual for that year and a half, and the normal routines were broken. So the challenges that we have seen, and I'll speak more into detail about that later, but the challenges are a lot greater now with students and their behaviors and the mental issues that are occurring with students. Not alone, also with staff as well, because we've had to deal with that with staff as well.
What type of services are available in the area concerning around mental health?
So we actually partnered up with Millie, and we provided mental health training to all the adult education instructors for UAM. So that way they could at least see the signs and know how to help and how to refer them to further their assistance on mental health. So we've done that for all of our instructors, parapros, everything in adult education school for UAM.
And we also did mental health first aid training. And so we had about 24 teachers to get certified, well, staff members to get certified in that. And then we also had UAMS to come out and do a training specifically geared to our secondary teachers and staff due to the incident that happened on our school building with a killing of one of our students. So we did how trauma affects the child and the brain. And so that was very eye-opening for a lot of our staff, just to kind of understand the impact of trauma and the various levels of trauma. So that was a great training.
Otherwise, go ahead. Go ahead.
To me, mental health is my peace, and it's so vital. And just listening to everyone speak, a lot in my field, in my arena, I know a lot of employers offer like employee assistance programs to offer mental health services to their employees, but some don't. We don't, my city does not. But in just thinking back and reflecting on some of the issues and situations that I've had to deal with, not just with myself, but with some of my employees as well, it's critical, and I think it's essential, and we need to offer it. I heard you say mental health training. I think when people are in certain positions, everyone needs to be trained on mental health, how to identify certain things, because when you factor in home life, when you factor in work, when you factor in school, really people are ticking time bombs waiting to explode. And sometimes you can say the wrong thing to the wrong person that on the wrong, an entire catastrophe breaks out. But if we have proper training and knowing how to identify certain things, it will help us, the trainer and the trainee, and overall help everyone. But it's a serious barrier and a serious lack of, even in law enforcement. That's something else that needs to be taught. I understand it's part of the curriculum now, or it's offered, but I think it needs to be mandatory, because my officers right now are dealing with situations with mental health patients, and we don't know how to properly deal with it, and it's a problem. It's a problem.
And I believe every educator that gets ready to go into the classroom, mental health needs to be taught at the university before they graduate. That should be required. One problem that we've seen in the Jefferson County area is a lot of those mental health professionals, those caseworkers, are leaving the profession. So we are limited, and a lot of our kids can't get in to see someone for sometime weeks, months, because they have such a large caseload, because they've had workers to leave and go to other professions.
But how we deal with the parents? Okay, you got the teachers, you got the students, and then they go home. So how we deal with them in that mental health issue?
Us as parents, we just deal.
We just have family. I think that we could partner up with the local public schools and offer some type of mental training, maybe offer some services to them.
I think that would be great, because, and I'm sorry for interrupting, but just when they had parent teacher conference recently, and I was speaking to my fourth grader teacher, and I was telling him about some things that my fourth grader goes through that I recognize as his mom. And, I'm in the process now of trying to figure out how do I get him the help that he needs, because I know that whatever it is, I cannot handle it. So, that has been a great deal, kids and their mental. It's been huge.
And we would love to offer parents training. The problem is getting the parents to come to the school for the training.
Right.
Even if we offer, even at the local churches, if we try and go into the community, I'm part of a community group, and we've done meetings in their community where we've gone to the community and offered.
Did we just lose the partnership?
I think so.
Yep.
Yep, I'm here, but nothing.
Okay. Okay, hold on. We're going to try to get him back. Jeremy, do you have a number to someone there on site?
I do. I'll find it in just a second.
Thank you. So for those of you attending virtually, Jeremy May is our gloriously talented tech.
Allison, I have somebody. I just texted Miss Morrow. Since she's on site, to let her know that we lost him.
Perfect.
Were we disconnected for a while there?
Yes. We're back with you though.
There we go. Yeah, now we hear you. Great to have y'all back.
Who was the last person?
Y'all missed some good stuff. How long have we
We solved all the world's problems. I love it.
Are we done with mental health? Because I had something I wanted say about it as well.
Find out first who,
We can
let's
do
find out who the
that.
last person was that they heard.
Yeah.
Allison, who was the last person you heard or somebody?
I heard about the parents not coming, even if you offered in the schools. That's the problem.
Okay, well, then we'll.
Okay, so I was saying that mental health in the Hispanic community is not talked about.
African American either.
So like in my household, when I was going, through depression and I was in my teenage years, and my parents, they were always like, we're not gonna talk about it. It was like kept behind closed doors. And then I went to school and talked to my counselor there, and that's how I was able to get the help I needed. So that's also a barrier in the Hispanic community, that parents are old school. They don't want to talk about that. That doesn't exist to them. And so their kids have all these problems or issues that they are not getting help with. And so that's also a big barrier.
And I want to add something she said about counselors. Our counselors now in schools, they don't have time to counsel because they are busy doing grades, testing, schedules, transcripts. They don't have time to actual counsel students.
Up to 250 students.
Right, right. So
Isn't it 250?
Yes.
High school level.
So that is a big barrier with our students having the availability of the counselor to be able to go and have those conversations because they are overwhelmed with all of the other tasks. So counseling is not a part of their daily routine. So that's another problem, a barrier that we have in the public school.
I would like to speak to, because I have a daughter who had mental health issues, and the lack of resources was one of the barriers we faced in the state of Arkansas. We live in Monticello, and the only inpatient therapy that we could find for her was if we transported her by ambulance to the Little Rock area. That's an hour and a half away from Monticello. That's 70 cents per mile. So the financial burden that caused. And then when she needed long-term care, we didn't find help for her until we looked outside of the state. So she was 6 months in Compass in Memphis, Tennessee. That was the only place we could find to help her. And as a parent, being in that situation, and an African-American parent, mental health has never been something that was openly discussed. You were stigmatized, you were called crazy or whatever if you voiced how you felt. So education about mental health and knowing that everybody has some form of mental health issue, whether that be depression. My daughter was depressed, she was cutting, she was substance abusing. We had a whole litany of things that we needed to work through with no idea how to even reach it. So definitely resources, mental health touches me to my core. And so I can speak on that all day as well. Thank you.
And I like to say, knowing what I like to call the heart language of a people is important when you're trying to deliver services to a people. So you have to go in that place to listen and not say, we have the answer, I'm gonna come and fix you. So for example, in that Latino community or the African-American community, we're the gatekeepers. Do we have ears to hear what is really needed and how to be able to convey that to the community? So that's going to be an important factor to really see the humanity of all people and know that there is something that they can share to help deliver that service, especially if we find that right person or people and learn the heart language. Secondly, as a child welfare attorney, here's one area that there's this obvious nexus. I'm not a mental health provider or anything like that, but the nexus between mental health, drug addiction, and then foster care cases and all that. So how, in fact, there needs to be more education and training. This is just me looking as the legal representative where I represented the state in foster care cases and also parents, where children are removed quickly because this person, right out of the hospital, because the baby tested positive. But what if there's a third party, there's somebody else in the home, and just the understanding of that process of recovery, that someone may be actually on track, but they'll just snatch the kid, or the kid cannot go back in the home. So there needs to be some education around what does recovery look like, and what, so that, in our area of the law, everybody's talking about what's in the best interest of the child, ultimately, but the trauma of that removal, and then understanding that. So legal professionals need some of that training on the bench, and practitioners as well, to help those families, which touches and concerns all areas of health.
By the way, Demetria is also running for judge. So
One thing I would like to add too, because I remember just listening and hearing you say you have services set up like for the parents and they don't show up, and just listening to what Eileen said, and I think it was Aprilla. Growing up, we've been taught, like she said, you have a problem, but if you say something, you're gonna get in trouble. Right. And people do think you're crazy. Right. And we were taught that. We were conformed to think that until we decide we know better, and then we have to seek out assistance and help for ourselves. And that's probably 90% of the reason why when services are set up for the parents and for the students, no one comes. So, and like Demetria said, find that heart, find that place to where you can really get to people. But if we don't recognize it, how can we? And we also need to know, be able to recognize those things in other people and figure out how can we get to them to enable them to be able to open up to receive the services and the assistance that's out here for them.
And I'll just say, how much more time do we have, Allison, here?
Sorry, Melly, it wasn't quite clear what you just asked.
The time, how much more time do we have here with this group?
Well, for this section, you can manage that, but we've got probably another 18 minutes or so.
Okay. I just want to say, just before we move on to this, that we do teach mental health first aid. We also have a program in the college right now where we're teaching every freshman class so that, those students then recognize it in their own classmates, because 1 in 4 think about suicide. But that needs to be accepted as it's okay. Like, everyone thinks things or acts out or has depression every once in a while or anxiety. So that conversation, like you said, but also delivering it, I think, is important, and getting folks that are part of our community trained to then provide that education outreach. And again, workforce our counselors need to understand who they're counseling. So they need to be a part of that community. And I think that's sort of another, mindset. I see these workforce people, I'm like, okay, but that workforce piece of it. But we'll kind of move on to dealing with like the safety and security issues, and we're kind of, focusing on women here, but are there any of those kind of barriers you see to women in safety, personal safety, spiritual, social, feeling secure? I think we covered a lot of some of that.
There's no shelters in town.
Yeah. Well, so I would like to ask the question, because Allison knows this is probably coming from me, but barriers that you see women in rural communities facing versus women in metropolitan areas, girls, women.
I think the more accessibility to shelters, those resources, those facilities where they can actually go, especially with children. So, I think that is a need, is for places that would allow women and children to come for safety reasons, or if they're homeless or abused in those type of situations. We need more of that in the rural area.
And I think we were just discussing before the meeting, if you go down to basics, even being that these areas are food deserts. So we're not even providing for the basic necessities to have a healthy life.
That's one of my big things, especially, you know, just access to healthy whole foods. And then the education of how that's important, how that's connected with many of the comorbidities in this area, you know, with just basic education on diabetes. I don't know the stats here, but I know it's high, you know. We have a huge, you know, dialysis place here. But in Mayor Butler's town, they don't have, we only have one grocery store in this town. When I grew up here, there were about 4, and they don't have one yet. There's someone who's trying to open one there. But it's easier to open up a dialysis place than to open up, you know, a place with food, with grocery. But also, you know, maybe some education around community gardening and not only gardening, but preparing those whole foods and seeing the true link between eating this and, you know, having a better quality of life. Like that's essential. And we're in a farming community. This is an agrarian community. So there should certainly be more access and partnerships with farmers who come out and say, hey, this is how you do it on a small scale. And now we're connecting community. Like this farmers, like you don't have to do it this big, but we'll take a trip out there and see what our farmers are doing. And then connecting, we're part of the Economic Development Committee, my mom and I, Miss Edwards is my mom. But we have a small farmers market that still needs some growth and development, and to be able to partner with our local farmers markets as well. I think that's important.
There's a program that they have in public schools. I think it's called Farm to Table. Is that right? And so that does, they offer it at the Boys and Girls Club at McGee, and they have a small garden, and they do try to teach healthy choices. But grocery stores, I completely agree. When you go into a grocery store and you do not see any fruits or any vegetables, everything is canned. That's an issue because you don't even have the choice of trying to eat healthy.
As a new mom, well, I have a 1-year-old, but I would say that accessibility to being a new mother in rural Arkansas is very challenging versus being in more of a metropolitan area. For example, if you're breastfeeding and there's not access to a lactation consultant around, you're easier to give up and just go to formula. And now there's a formula shortage, and it's just kind of irritating when you just have a newborn and you're going to Little Rock sometimes to go just for your checkups and everything. And it's very regular, and it's just kind of having a baby in Southeast Arkansas is a lot more difficult. And especially if you're a high risk pregnancy or your baby's high risk, they recommend you go into Little Rock. And it just can cause a little more complications, I think, as a new mom. And
being a mom in Southeast Arkansas, being a mom, period, in Southeast Arkansas is more challenging because I have a daughter who's diabetic and I have a son who has asthma. And I have to be off frequently from work to drive to Little Rock to take them to see the specialist, you know. And my daughter was diagnosed with diabetes when she was going into the 5th grade. And that is something that I noticed with her that was going on. And I actually told them, y'all, I think she diabetic, you know. And that's how I was able to get the referral to Children's, because I told them I think she's diabetic. And so they sent us to Children's. I had a really, really hard time getting a referral to Children's for my son for his asthma. It was very out of control. And living in Southeast Arkansas, you know, that don't help at all. So I have to take off frequently to drive my children to Little Rock to see these specialists, because we have nothing here that can, you know, that can help them with the things that.
And that's a full day.
That's a full day, and sometimes it can turn into a full 2 days, or, you know, so forth and so on.
Yeah, you know what, you're right, because my daughter has said, don't way I got her, there was one of my sister-in-laws had referred me to her pediatrician, and the pediatrician referred me to the specialist.
And it's,
Little Rock.
yeah, and it's not only just our children, but we also are taking care of our grandparents, our parents, our aunts and our uncles. And sometimes we're the only ones that have vehicles that can transport them. So, I mean, it's not just in one, it's every concept of it.
And for me, being Hispanic, most of my family doesn't speak English. So, and there's not a lot of interpreter services here. So that's a big issue as well. And so my parents live in Dumas. And when I got married, I moved here. They still call me. Can you can you translate? Can you tell the doctor this? Can you tell the doctor that? Can you set the appointment up for me? Because there's just no interpreter services here in our area. That's also
Well, I think.
Hey, Melly.
Yeah.
Just a couple of questions here in the chat. So first of all, does anyone have any experience with rural development and USDA extension services providing some of the some assistance that maybe hasn't covered here before that we've been talking about today, services that maybe aren't still being used or that might be used in terms of mental health or other things?
I think our local extension, at some point, they had some things related to gardening that could be helpful. They have those.
That's a mental health.
They offered food banks where they would set up at certain areas and do provide a basket of food, but I have not seen that since probably a year.
I think they still have the backpack program for kids to take home on the weekend.
We don't actually have a local.
Dr. Jones-Branch, did you have other experience that in services that you'd want to highlight? We can maybe bring that up with USDA directly.
Yes, hi. The extension service, the Arkansas Extension Service provided virtually all of the services you all are talking about once upon a time, probably a very long time ago. Mental health, home demonstration clubs. I think there are woefully few of those now, but they provided information and demonstrations on how to breastfeed, on mental health care, on food insecurity, all of those things in rural areas like Chico County. So that's why and the extension service still exists, by the way. So I was just wondering what your contact was with them and if those kinds of services are still available. I don't know. I mean, I write about the extension service in the past where I know they did everything that you're talking about in here today, but I don't know what they're doing in the context of the 21st century. But it's very clear to me that whatever they were doing before, they need to resume doing it if they aren't currently.
Yeah, absolutely.
And if they are, then they need to make it accessible to everyone, because I've never even heard of them providing this service, and I was desperate, and I looked and I searched everywhere and could find nobody to help me.
Well, so I'm going to take that for action. So in a stroke of small worldness, the new regional or new state director for USDA is Jill Floyd. She's also the chair of the Women's Foundation Board. So we've got a good connection there. So I've made a note that I'll follow up with her directly on that. So Melly, we got about 7 minutes left. I'll turn it back over to you.
Well, I think, I think the final question to this group really would be, as we have spoken about all this, what policies or practices in Arkansas government do you see could address, these barriers? I mean, this, like I did tell them, the commission is writing a report, and we're hoping that through this, comes out some suggestions, solutions, to move this forward and to turn the needle on some of this.
In the schools, I would love to see funding for a mental health worker in our public schools. A lot of schools have the challenges of financial issues. So if the state could find some funding to provide mental health workers in the school or therapists, that would be great. and also to be able to have mental health as a required course in college, especially for educators that are getting a degree in education. They need to go through a mental health course.
Maybe add that to the professional development that's done yearly.
Yes. And also the requirements on the counselors. Counselors need to get back to actual counseling. So it would be nice if some requirements, they have the 90-10 rule, but realistically, the policy is not working. And I think it really needs to be looked at, the reality of it within the schools, so that policy can be monitored a little bit to allow counselors that time to be able to provide actual counseling to students that are in need.
And Allison, I did want to point out that we have been approached, the partnership has been approached by legislators who are addressing the mental health crisis, and we have been asked to demonstrate a mental health first aid class to them. They're extremely interested in seeing how that could be implemented further. So that is something that is a little bit in motion, I think, I hope.
Fantastic.
More information regarding like virtual options for mental health provider and for that appropriation for that, and sites, technology sites like this for people to be able to come. So if you're doing not only the children, but also the adults who would be interested, if there was a safe place with the technology there for them to meet with a provider and have a site like that available on school campuses and in the local community, that would be something that would be helpful.
That's what we saw her workshop. That's great. But, you know, as we address, and Dominic, I'm kind of going to point at you, but, you know, any of the mothers out there, because we, you know, have these other, you know, subcommittees in family caregiving, you know, looking at policies and actions and in that area. I mean, do you see any suggestions? Or
I think,
and Demetria too, I mean, you're in the court system.
I think I heard her say, like, I'm gonna just say, like, with my job, like, we don't get the option to be able to go to a school function. You know, I think I heard you say, like, people get like 8 hours. Like, we don't have that option. Like, we have to take our PTO if we're gonna take off or something like this. So I think all the way around the board to put a policy in place, you know, so we can have that option. Other than having to take a vacation or sick day or no pay.
Right.
Yeah.
And it's very important to have not only the mother, but the father in the child's school as well. So being able to provide 8 hours for the mother and the father, I mean, that would be fantastic.
Yeah, also, like I was saying earlier, maybe some legislation around what we call Garrett's Law, removing kids or from the hospitals when mothers test positive and so do the babies. So having some sort of policy connecting mental health, drug counseling, and the removal of children in child welfare areas, not just at the hospital level, but then once they're in the foster care system. There needs to be some talk and policy that's around that.
Well, Allison, is there anyone else out there that have any other questions for the group?
Thank you. Yeah, let me just open it up to the commissioners. Anyone have questions for this group of folks or comments before we wrap up and move to speakers?
I had one question in the chat. Do you have any, someone mentioned that their child has asthma, which led me to wonder if you have concerns about environmental issues.
As the planes are flying over us and spraying everywhere we turn.
Yeah, I would say, because I think if we lived maybe somewhere different that didn't have all the crop dusters and everything going on, then the asthma problem would be a little better. But we deal with it year round. Like every day is a challenge, you know. So environmental,
Cotton ginning season is especially.
But environment pollution is definitely,
Yes.
definitely an issue in Southeast Arkansas because of it being agricultural. And the different chemicals they use at different times. I mean, they really don't know what the chemicals' long-term effect will be.
Thank you.
Allison?
Yes, go
This
ahead,
is Kathy. Can I make just a quick comment? I put this in the chat, but I want to make sure that the folks in the group get this. If they could write down my email address, kweb@arhungeralliance.org. Based on the conversation about the food deserts and the gardens and those kind of things, the governor's getting ready to appoint a task force on food deserts within the next few days. And he's also generously made some dollars available for some things like garden implements and things. And if the folks in the group who were talking about that would email me, I could make sure that they're included in this discussion about food deserts and also about the access to some of the healthier food. Thank you.
Thank you.
Can you say your email one more time? I'm sorry.
That's okay. Kwebb, initial K, WEBB @arhungeralliance.org.
And Melly, we can certainly send that out, follow up as well with the notes from today's meeting.
I also have a suggestion, Kathy, if I may. This is Sharice Childers.
All the way up there.
Hello. Would you please see if there's someone that can be included from the association that represents family and consumer science teachers on that commission, so that they can get that message out to all the family and consumer science teachers around the state who can be supportive of this effort in all the schools.
Would you shoot me an email? I think we're on the same subcommittee and we can talk about that if that works.
Yes, I'll be glad to. Thank you.
Thank you.
All right. Thank you, everyone. Melly, we'll go ahead and turn it over. Well, first of all, thank you to all of the incredible women that you have there in Lake Village. Really great discussion today and some meaty recommendations and things that I've taken notes on to follow up on so that we can build some of this into the report. So thank you so much for those of you who are there in Lake Village in person. And Melly, we'll turn it over to you now for your speakers.
Sure. Well, next up, we have Craig Wilson. He's the Director of Health Policy for, a lot of you know him as ACHI, which is the Arkansas Center for Health Improvement. I think all the commissioners have got his bio. I just want to thank him for being on here. He's had to deal with me a lot. He just went through a strategy meeting with me for 2 days and my group with 15 hospital administrators. So, but Craig is very much a proponent of anything healthcare. So I'm going to let him take it away. He is an instructor, so he's an incredible presenter. So Craig, it's all yours.
Thank you, Melly. You set me up all too well. I just want to say, first of all, it is not lost on me the fact that I am a man talking to a group of women about the COVID-19 impact on women. It was very enlightening hearing the conversation. And I think that probably what you hear from me today is more going to be confirmatory rather than new information. I'm hopefully going to be able to give you some of the empiric information that will help you kind of populate your report and hopefully lead you to some solutions. My discussion today, which I'm going to speed through pretty fast, is really going to be focused more heavily on the health impacts. But as you all recognize and completely understand, our health is more impacted by where we live than anything. And being from Southeast Arkansas myself, I can tell you that I know that very well. So let me jump in. I won't get into our organization. We've been around for 24 years. We're Nonpartisan Health Policy Center. But importantly, we serve as a catalyst. And we can't do anything without partners, including many of you in this room and others who are not here today. Let me frame it up for you in terms of the extent of COVID-19 more generally. When we're talking cumulatively over the past little more than 2 years now, as hopefully we enter the late COVID period, we have had nearly 850,000 COVID infections. Now, some people may have had it more than once, so they may be counted in here twice. But you know that it's about 3 million people in Arkansas. So that's a lot of infections. We had hospitalizations close to, this is just as of the other day, close to 37,000, more than 11,000 deaths. And we just have about over half of our population fully immunized. And when I'm talking about fully immunized, I'm not talking about optimally immunized with the booster, right? This is just the primary series. So we still have a long way to go in terms of vaccinations. When it comes to the impact on women, if you look on the far left here, this is for Arkansas. The population of females in Arkansas is about 51%. There were slightly higher numbers of cases among females. However, there were fewer hospitalizations and fewer deaths among women in Arkansas, despite having higher infections. What we do know from the literature thus far, and I do want to say thus far importantly, and highlight that, because as with any new disease, we're still continuing to learn about. What we do know from the early periods of the pandemic was that among hospitalized women, they were less likely to die from COVID-19. However, once that severe disease occurred, even in the hospital, that perhaps resulted in intubation, the risk of dying was very similar to men. And part of the reason that we think that that they were less likely to die from COVID-19 is that women were more likely to be vaccinated. About 52% of women received at least one dose compared to about 48% of men. Similar numbers there with those who were fully vaccinated, and those who were more likely to receive a booster dose were women, of course, as well. So 55% versus 45% of men. So higher levels of vaccination rates among women. Just for a little historical context, as you all know, women have historically faced challenges in workforce participation. And I didn't put this in here to educate you, you know this. But I put it in here to talk about historically where we started from pre-COVID. Challenges in the workforce participation rate, although it's vastly improved over the last particularly several decades. Females, their workforce participation rate still about 12% lower than men. And pre-COVID, women were more likely to be in low-wage jobs. They were more likely to take on a majority of the family caregiving responsibilities. And these are more national numbers. So in Arkansas, you can expect that the percentages are probably even higher here. More likely to face difficulties in securing and affording childcare, as you guys were discussing before, and they were more likely to leave the workforce due to childcare responsibilities compared to males. Now, what we know is that everything that was wrong before, COVID-19 only exacerbated it, right? So the virus, if anything was that we can say that was that this virus was good at, it was ratcheting up the existing tensions in our system. And that's not a good thing for us. But certainly the virus excelled at that. We know that between March and early April of 2020, this was right at the beginning of the pandemic, the employment rate dropped by 15% among non-college educated women and only 11% for non-college educated men. And then in that roughly same period, mothers of children under 12 lost 2.2 million jobs compared to less than half of that for fathers. Importantly, in Arkansas, women represent almost 4 out of 5 people who work in the healthcare profession. We're talking hospital workers, LPNs, RNs, doctors. We're talking about people in long-term care facilities. And then about a similar percent in educational institution occupations. And you know that these were the people who were on the front lines. So, it's not unanticipated that a greater percentage of women working on the front lines here, they're going to be more likely to become infected with COVID-19. And then women, as was discussed earlier, are more likely to be primary caregivers for elderly or disabled family members. And we know that those were some of the most vulnerable individuals when it came to COVID-19. So the worry and stress factor on top of just being able to care for someone was a compounding factor. And then program participation in Arkansas. So really quickly, in the WIC program, Women, Infant, and Children program, this was just in 2020. Over the first year of the pandemic, there was a 5% decrease in WIC enrollment. That was despite the fact that you had such income disruption. And by the way, the income eligibility for a family of 4 in Arkansas to be eligible for WIC is $45,000. And for SNAP here, Supplemental Nutritional Assistance Program, it's about $36,000 for a family of 4. So 74% of SNAP participants are families with children. And then one of the major things that I do want to point out is due to some federal requirements early on through Congress, states were required to maintain eligibility and not terminate coverage through Medicaid for individuals who were enrolled or who came on during the pandemic. And that is still in place. So enrollment grew by more than 200,000 in Arkansas Medicaid and the Children's Health Insurance Program. And about 60% of the population in those programs is female. So when the public health emergency ends and the state has about 6 months to redetermine eligibility, we're going to see a differential impact potentially on women who are in that program. You guys were talking about mental health services, and I'm going to get there in just a second. But I do want to mention more generally about physical health. Women were much more likely to have gone without healthcare during the pandemic. 1 in 10 women reported delaying or not obtaining birth control during the pandemic. Women with health insurance were almost twice as likely to receive a test, which could have resulted in more of the female population, but being reported as having an infection. And then 27% of women who identified as being fair or in poor health reported that their condition worsened as a result of skipping that medical care. However, there were some bright spots. Women were much more likely to report use of telemedicine services, which became much more available, particularly at the outset of the pandemic. It's still 38 times higher in terms of utilization of telehealth services than where it was prior to the pandemic. But women were much more likely to use that. Unfortunately, it was individuals who were 25 or older, more educated, those who had health insurance, who were accessing those services. So we've got a lot of ground to cover on the disparity issues, both in terms of demographic disparities and geographic disparities.
I'm really afraid of
which I'll mention, in 185,000 women. Utilization for in-person visit declined by 60. To 90%. That was the reduction in the number of screenings that were occurring during that time. And we already know that we had some issues, particularly on a geographic level. This is prior to the pandemic. And
Hey, guys, is the connection issue on our end or is it on Craig's end?
It may be on his. I can still hear you guys fine, but he's dropping in and out.
Okay, we're just confirming that.
And you can see there's a 20%.
Hey.
Am I back?
Yeah, I think.
Yeah, you're freezing.
Okay, sorry about that. I think it's on my end for some reason. That's rare. Can you still see my screen?
Yeah.
Yes.
Okay. All right, I'm going to move on real quick. For mental health services, about half of women reported that pandemic worry or stress affected their mental health. You can see the difference there in men. Men, of course, are less likely to report that they were affected by mental health. The stigma still as well. Unfortunately, even though they reported heightened mental health issues, only about 50 of that is a big gap there. I'm going to leave. I know we're running short on time. Pregnant women faced a heightened risk for COVID-19, and because there was knowledge about the impact of vaccinations on pregnant women and the potential for adverse outcomes, vaccination rates were lower among pregnant women. But more recent reviews of multiple studies show that there was really no evidence of adverse outcomes, and risk of stillbirth was 15% lower among vaccinated versus unvaccinated pregnant women. We also know that the impact of COVID-19 on pregnancies was much greater than anything we saw from any vaccination adverse outcomes. Really shortly, we don't know much about long COVID yet and how that's going to impact our population. There can be different types of long COVID as a result of direct cell damage from the virus itself. Symptoms from chronic hospitalization for those who were hospitalized for a long time. And then there are some who experience symptoms appearing completely after recovery. And these are some of the common symptoms here that we're starting to see in observational studies 4 weeks after infection. But some experience more impactful organ damage with some long-term breathing problems, heart complications, and even kidney impairment. And we are starting to see that women are impacted much more so than with long COVID than compared to men. There's a study there for you as well. And then the last thing I want to mention that I think was vaguely referenced in your discussion, we also had a shadow pandemic going on, that resulted from the economic disruption, from just life disruption. And generally, we are still seeing and have seen from the data in 2020, significant increases in gun violence. And I want to make sure to note that that is not just an urban issue. We all like to talk about the crime in Little Rock or crime in where I'm from in Pine Bluff, but the gun violence issue is much more so in rural areas than we have ever seen. And it's creeping into many of our communities. But not just gun violence. There was a lot of domestic violence. And these cities here are Jefferson, Alabama, Portland, Oregon, New York City, and San Antonio. Increases of anywhere from 10 to 27% in intimate partner violence. And one of the things I want to note, there was a study at a Boston hospital from March to May of 2020, and radiology scans and superficial wounds that were consistent with domestic violence exceeded the totals for the same period in the previous 2 years combined. So that's a pretty shocking revelation there, and something that I don't think has gotten a lot of attention. We talk about the mental health issues. We talk about the direct physical health issues. We talk about the economic disruption and the school disruption. But we also experienced a shadow pandemic for the children, for intimate partners. And that's one of the things that I think just needs to get more attention. That's just some contact info if you guys want to get in touch with them. I'll stop there. I know that was fast, but it was right at 20 minutes.
Okay.
Thank you, Craig. Yeah, go ahead, Melanie.
Okay, and next up, we have Carrie Williams, who's sitting right here and has been having this great discussion with us. She's the district administrator for the Watson Chapel School District. So I'll let her speak.
Okay. And I'll give you a quick background. When we had our school shooting, students were crying out for help. And I walked into a group of students who had done a walkout at school and started talking to them about what they needed. And they didn't say mental health, but a lot of things that were characterized as mental health came up. So I started doing restorative circles with them to give them a voice and to talk. And so that led me into connecting with Amanda Cookencutter for first aid, mental health first aid training. So I opened it up to all staff to see if they were interested in doing it. So I had about 24, 25 staff that were interested in doing the mental health program. Through this, I wanted to find ways that kids could anonymously let us know that they were having a problem. So I did a anonymous Google form, what I call the check-in form. And all the teachers posted it on their Google Classroom. The kids, it's a link around the school, and any device they can just go on if they're having some issues. I have some copies, and I'm sorry I don't have enough for everybody, but I have a copy. The first sheet, the white sheet, is the check-in form. And based on what grade you in depends on the type of questions, because I wanted to make it K-12 friendly. So of course, for the younger ones, I have faces. And then it goes into more detail for older students. As of yesterday, we had 169 students to fill out the check-in form. Out of that 169, we had 18 that were crisis. So those were our wanting to commit suicide. They were doing self-harm. They were cutting. That ended up with a crisis transport to the hospital or to the behavioral health center immediately.
Tell them the time frame, see if I could, I mean, it's not been like years.
Oh, no, this is just for this school year. So I put out the check-in form in September. And from September to now, this is what we've had to deal with from September to now. And there are some that are not on the sheet because sometimes I'm walking down the halls and I'll see kids that just don't look right. And I'll ask if they need to talk. And then, so we'll go to an empty classroom and we'll talk. So a lot of times I just get stopped in the hallway or pulled by a teacher. And you know, so it's more than what is recorded on the form. I just haven't had a chance to go back to my notes and add more students. 117 students were counseled or set up times to meet with other trained mental health staff to kind of check in on a weekly basis or every couple weeks. 34 of them I did emails and text messages. You know, they didn't want to talk in person, but they were comfortable with email and text messages. So, you know, I did that, and they had no idea because I had a anonymous email set up. So they had no idea it was me. I think they've come to figure out that it was me, but I wanted them to feel free and to talk to someone. Sometimes when they don't know the person, they talk a little bit more. That worked really well. The yellow sheet that I gave out is actually some of the responses from the kids filling out the forms. So if you just look at it'll say, how are you feeling today? I mean, we have a variety of every emotion that you can have. And then I'll ask them, give me a few details of why you feel this way. Some they don't know. One person says, short version, the person that caused me trauma is now getting happily engaged and I have to act like I'm happy, but I'm not. And the backstory behind that, when I talked to her, this was someone in her family that raped her. So, you know, we're dealing with kids that have so much trauma that, you know, we've only begun to touch the surface. A lot of them have said that I just don't feel good. I'm stressed, tired. Friend was murdered last night. Some don't know why. I just feel this way. I just don't feel good every day. I wake up and I'm sad. So I had a variety of things that the students said. And so based on what they said is what would determine, okay, what are my next steps? Because I was the only one to receive the responses. So either I would, if it was something that, you know, like, I don't want to live anymore, or I feel like my life is not, you know, worth it, or it's not good, and it's never going to get any better, then I would stop what I'm doing, go over, pull the student, and we would have conversation. And then I would determine where we need to go from there. And some it was, okay, let me connect you with a teacher that I think that you can work with to kind of see if that teacher can talk to you. Like one student, she was just overwhelmed with work and school. She was working outside of school. She was helping take care of her younger siblings and of course schoolwork. So one of her things was time management. So I hooked her up with a teacher that was really good with organization. They were able to sit down and work her out an organization schedule that she had on a daily basis. So that relieved a lot of her stress right there. So it just depended on what the student needed would determine what staff member I would assign to that student. And then if you look at the blue sheet, I decided to do mental health Mondays. So we have pride time for students, 40 minutes a day. They either get remediation. If they don't need remediation and intervention, then they had a choice of where to go to. So on Mondays, we designated mental health days. So I would write lesson plans, totally scripted for the teachers so they didn't have to do any work. I would give them all the materials, and every week they would get a lesson plan, and that's what they would go through with their students to bring the awareness of mental health. So I knew at that time, every student in the school was getting some type of mental health lesson. So we did that every week. And then the last sheet is what my teachers reported after they talked to a student. So you can kind of see what the conclusion was, what the next steps were. So then they can, you know, you can kind of see a lot of length that our staff went to. And this is teachers that are teaching full classes, full schedule. And this is things that they did either right after school or on their planning period or doing lunch. So this was in addition to all of the other duties that they have. They volunteered to do these things. So it was great. And they helped out a lot. I do a lot of restorative circles to prevent students from getting into fights. And most of the time it is girl drama. Girl drama is just, you know, they don't know how to talk to each other. They don't know how to communicate. They don't know how to direct their anger. One student told me the reason why she decides to fight is because she is so angry inside. That's the easiest way to get it out. Even though she understands the consequences of fighting, She said, well, I don't know what to do with my anger. I'm just so mad, and I'm mad all the time. So when I have students to tell me things like that, you know, it's like, okay, what can we do to put in place to help her redirect her anger? You know, first we got to find out what she's angry about. So sometimes those conversations go very, very deep, and they go over multiple days. I even have students to call me. I had one student to call me at 12:59 because it was a social media issue that she had got upset about, and she said she was coming to school to fight another girl. And so I'm glad she called me because we were able to prevent the fight. But, you know, again, that was at, you know, after midnight, you know, on a weekday. So the kids need someone to reach out to. Right now, they feel like I'm all they, you know, they can only contact me. So that's why I said we need mental health workers in our school that have gone to school and trained to deal with it. My training is limited, but I can care and I can talk and I can point them in the right direction. You know, and they like talking to me, but we need someone designated for that to do just that. Yeah.
Carrie, thank you so much. And Craig, thank you for sharing both your experience and some of the data and research that you've done in this area. It's really helpful for us to hear that. Melly, do you have any closing remarks before we adjourn for the day?
No, I just want to thank these ladies for driving. I mean, some of them drove 2 hours to get here, so really appreciate it.
Yeah, it's really wonderful, really grateful to everyone who's there in the room and for those who participated online. Again, I want to thank our special guests and our guest speakers for sharing their expertise and their experience, and for all of our commissioners for their dedication for this commission. Just a quick note that our next meeting of the Arkansas Women's Commission will be in Mountain Home on June 13th. Dr. Kathy White-Lloyd will be our host there. Further details for that meeting are forthcoming. And with that, this meeting is adjourned. Thank you, everyone.